We cannot address death by law enforcement killings unless we address mental health. 1 in 4 fatal police encounters ends the life of someone in acute mental health crisis. When you call 911 and you have a fire, who would you like to come?
Firefighters.
Firemen. Preferably, in my case, a single cute one. If you have a mental health crisis, who should come? A mental health professional. This is like the dark underbelly of 911 that we didn't really think about when we created 911, which is our dispatch doesn't have all of the right responders. Those folks are amazing. Dispatchers are amazing professionals. They are incredible at figuring out what the problem is, but we have to give them the right responders. So this bill would create a grant program to enable cities and counties to create dedicated mental health response units to send in lieu of police. And it's important here to understand all of the research, all of the pilots that are out there in places like Eugene, Oregon, and Denver, Colorado, and ready for this? Huntington Beach does this. Show that sending police with mental health providers leads to a command and control, 2 different approaches. It is best to send the mental health provider when dispatch in their professional judgment believes it's a mental health problem. They can always call for police backup. They do so in less than 0.5%. This is way cheaper, it is way better, and it connects people directly to care. And in about 80% of those calls, the person is not institutionalized or incarcerated. They are connected to an immediate follow-up appointment the next day, or even the same day. So this is a big part of what I've been working on. It's a really big part of how we're going to address police violence, particularly police violence against people of color. The second thing I care a lot about is youth mental health. And so I have a bill here to help colleges and universities. There was just a big New York Times article about this. Colleges and relating to my alma mater, Yale, and how they basically tell people who have mental health problems, I'm sorry that happened to you, and do not come back. That is a violation of the Americans with Disability Act, and it's also an incredible loss of talent and acumen. So we have students that our tax dollars are helping them get into college and helping them get going on college, and when they get sick, we want them to be able to come back and to finish when they're able. So this bill would give clarity to what colleges and universities need to do. I'm also really excited about the mental health specialists that we funded during the pandemic to go into schools. These are not your grandmother's guidance counselor. And they let, by the way, the guidance counselor do their job, which is to identify academic supports and help connect people to resources. These mental health specialists provide direct therapy, but they also teach resiliency and coping skills. When you have 1/2 to 1/3 of kids saying they're experiencing anxiety or depression, that is not a problem you can just deal with one therapist at a time. You need to treat it as what it is becoming, which is a big public health crisis in the United States. The last thing I'll mention is I like to light insurance companies on fire about mental health. We passed the Affordable Care Act. We promised that mental health would have parity with physical health. This is a great example of the need for oversight. We passed that law, and shocker, big insurance didn't do it. And here we are 10 years later, and what we know is when you look at your insurance and it says the copay for mental health and is the same, and you think you're going to have this coverage, but then when you or someone covered under your plan needs it, what you learn is there's nobody in network, there's nobody taking new patients, there's nobody without a 6-month wait list. And as I said to Kaiser Permanente, and I'm a Kaiser patient, that's why I have my health insurance in Congress, is through Kaiser. When you take someone's money for a service and you don't give it to them, that's called stealing. And they said, we don't like the sound of that. And I said, do you prefer cheating? So our employers and we are all paying for these premiums, and the insurance companies know that they do not have the network of providers, and it's due in part to the lousy reimbursement rate that we give to mental health professionals. So really proud that a number of my mental health parity laws were passed into law. One of them would require something you can't believe we didn't do 10 years ago, HHS to actually audit mental health providers at the insurance level and look at things like network adequacy and limitations on treatment, on how many appointments you can get and things like that. So really excited about that.